We blew our entire budget on that intro.
It never gets boring, man.
I know.
Every time I watch it, I'm like, oh, I feel like I'm about to play a fun video game.
Yeah, we kind of are, aren't we? This is kind of a fun video game.
Yeah.
So I'm excited. I'm pumped,
Dude.
today.
This is like, you have been talking about this for weeks.
Yeah. I've been talking about this for more than weeks.
Mark is very excited.
We won't go into
the we have today.
We won't go into the timeline of why.
No.
But,
not necessary.
we have been watching this guy for quite some time. I would argue that nobody on this planet has brand figured out in dentistry better than this guy.
Absolutely.
He is he's an artist, a photographer, and an amazing aesthetic dentist.
A fine clinician.
And he's a Canadian, another fellow Canadian.
Making Canadians proud.
Yes.
With like such great brand prowess.
Oh, I like
that word?
I like it. Yeah, good job. Without further ado,
Let's not waste any time. Let's get him on here.
I know. I'm wasting time here.
No, it's good.
Just
It's a
gushing.
good intro. We do have to intro him.
But we turn off the music when we do that. So, anyways, Dr. Chee, thank you so much for spending some time with us this Tuesday evening.
Yes. We know how incredibly busy you are, so to take the time out of your busy schedule to join us, we really appreciate it.
We understand that you have.
Thank you so much for having me.
Oh yeah, it's awesome. We understand that you have a study club tomorrow to discuss marketing topics.
Yeah, I'm on the advisory board of the Seattle Study Club group here in Calgary called Evolve Alberta. So it's actually a new member night for us. So we're
cool.
inviting a lot of new potential members. And I'll be talking on social media marketing and how to make it effective for increasing your revenue in the
Hot
practice.
topic.
Yeah,
Hot topic right now.
let's jump into that because how many Instagram profiles do you have now, Gordon? She like 60?
Too many.
Tell us about that journey.
Yeah. How do you manage them all?
So, well, it just kind of grew and grew. Like I started with our office one called Aesthetic Dental Studio, and that's our oldest one. And with that one, the purpose was always to, bring in new patients, support our practice, and it was kind of like my main account for a long time. So then I ended up getting a bunch of dentists following. And then over time, I started getting requests for to lecture and do courses and whatnot. So then I decided just to have my Dr. Gordon Chee account, which was more geared towards dentists and education and things like that. And because I do so much photography and I really enjoy portrait photography and, take a lot of pictures of patients and models and pageant.
Yeah. They're fantastic pictures too. Like you're an artist.
So a lot of those pictures, the models weren't really smiling in them. So I'm like, well, this isn't very dental related, but they're really nice pictures and I needed somewhere to put them. So then I created another account called Create Photography, which is actually the name of my photo courses. And then I just kind of threw all those portrait pictures on there. So
Awesome.
It's a bit more. So that account is a bit more just purely photography focused.
Cool. And how are you finding is that so how are you finding that? Is that generating good traffic for you?
Our Aesthetic Dental Studio account does pretty well. We do get a lot of new patients coming through IG, and we do get a lot of direct messages. I think the one thing that has changed in doing that sort of marketing is our reach has gotten much larger. And
Right.
So early in my career, I'd say, most of the patients were sort of in the same quadrant of the city or just in the same city, where now we're getting a lot of patients traveling in from like say Edmonton, Saskatchewan, BC. So and then just like patients from all over the city, whether it be at the far end of the city. It kind of makes location less relevant when you build up a good like social presence.
Totally.
Sure.
And how does that look like? So you have somebody out of town that's interested in coming to see you. What do you do step by step there? Like how are you bringing those folks in? How do you do like a distance consult? How does that look?
So a lot of them start off with just like a virtual consultation. So they'll usually either DM us directly, or they'll go onto our website and say, I'm from Edmonton and I'm interested in whatnot. So then oftentimes, because they're out of town, we'll schedule a virtual consultation with them, where I sort of try and diagnose them as best as I can over a computer.
Of course,
and
right.
just give them an outlook of what the treatment would be like, and then usually they'll schedule coming in, like a lot of our cases, because we're an aesthetic boutique practice, a lot of it is like a veneer small makeover case. So they'll come in, and then we usually start off with like a record taking appointment anyways. So they'll come in, we'll sort of do like a bit of an in-person consultation with them and just kind of confirm everything that we were sort of talking about in the virtual consultation. And then we'll do like scan photos, x-rays of what we need to get all our records done, and then sort of continue on with booking like probably 2 more appointments, one for the preparation and one for the insert.
Cool. What types of tools are you using to communicate with the patient in terms of, at that initial stage? Are they sending you photos? Is it just verbal? Is it purely verbal conversation about what their needs are? What are you using?
Probably starting with a discovery session.
Yeah. So we have on our website like a little form for them to submit photos.
Oh, okay.
So photos are always encouraged. It'll help us get a better idea of their situation.
Mm-hmm.
Sometimes the photos are of mediocre quality, so it's sometimes hard to tell. But we have like directions of how like the angles that we want and
right.
whatnot on that form, so then they can do their best to submit photos for us to have a look.
Can I have a quick question about, so just going back to like sort of as you were sort of transitioning, or not transitioning, but as you started to do more on social media, was there sort of a point where you realized, hey, there's the Google machine and then there's social media. So like, was there a point in your journey where you were like, wait a minute, this social media thing seems to make sense for me, and maybe there's a brand building component to this. Was there some point, did you have sort of like an aha moment when it came to social media?
I think when I started, it was really just to, number one, just have an Instagram account for a business. But that's when I started really trying to bring photography into my practice, because I was really into photography like outside of dental first, and then decided to try and incorporate it into the practice. So, the first little bit of my account was really just sort of experimenting with that and trying to take some, artsier photos of the dental work that we did. But then, over time you started getting some traction, and I guess it was maybe like the very first time we actually had a new patient come in that said, "Oh, I followed you on Instagram. That's how I heard about you." That, the light went off, and like, wow, there's actually people that will actually choose a dentist based on their Instagram account. And so it kind of started off a little slow. Like I think some of those cases were, just a bit of bonding or whatever, or a chipped tooth. But then one day I was contacted by this patient, and she's like, well, I want veneers like on all my teeth, top and bottom, and I need it by like next month.
Yeah, right.
So they came in. Yeah, so they came in, spent like $40,000, and that's when it really, I guess, validated like the power of the Instagram account, because I'm like,
It
holy
is,
crap!
yeah.
Like, we just posted a few posts and some photos, and all of a sudden we got this $40,000 case.
Yeah,
so,
So
so after
maybe that was
that,
the aha moment, right?
yeah. So after that, we basically just put big emphasis on our social media, and it's kind of grown our brand, and like stuff has come out of that as well, like a lot of lecturing and teaching opportunities and courses from other dentists around the world noticing. So it's really kind of expanded, and I got approached by some companies to be KOL and things like that. So it's really amazing how it's helped my career blossom. So I'm pretty
And I think
thankful
that
for it.
you sort of hit the nail on the head when you talked about, and this is sort of why I really like your answer, because you talked about how, it sort of came from a place of organic, I guess, maybe passion. It sounds like you have a passion for photography. So that really kind of, it showed a real organic, like natural progression into the social media, which is really kind of, in my opinion, where social media can be a real explosive, amazing tool, especially in dentistry, where you can, like when I look at your Instagram, I see, beautiful aesthetics, but I also see like lifestyle mixed into it. Like there's a component to your social media that I look at and I go, man, there's some really cool lifestyle
It's
pictures
genuine.
in here.
Yeah.
It's genuine. It's a real authentic feel to it, to say, hey, yes, we do aesthetic dentistry. We take great photographs. We obviously have a passion for great photography as well. So you're really kind of taking a blend of a bunch of different things and putting it in here, and it really kind of looks effortless, and it looks like something that you're driven to do through passion. So
I got two questions. Okay, so the first is, now this has now evolved into you helping out your fellow colleagues figure out photography and their own social media channels. How did that start? Is that something that you were just like asked like a ton of times, hey, can you help me out, and then you just decided to just go for it?
Yeah, pretty much, I would say. It's like I get a lot of DMs from dentists asking me questions, and then I just at the time I had never really taught courses before, and I just got more and more dentists saying, "Are you running courses? Like, I'd love to learn from you," and it just kind of happened from there. So I guess just from dentists.
And you fill up these courses in like 39 seconds.
Yeah.
But you keep them small and intimate, right? I think that's key, because a lot of learning this stuff is to really like immerse yourself and understand lighting, and everybody has a style when it comes to photography too, right? Everybody has a different eye in it. So here's a really important question that I need to ask. So you're stuck on a deserted island, okay? You have
I like where this is going.
You have two choices, okay? You have
Is it warm? Is it tropical?
Oh, it's nice.
Is the sun shining? Because I'm ready for some sun.
Yeah, there's
Exactly.
there's a tiki bar, okay?
There's a tiki bar, okay.
Yeah, and a buffet, so you're fine.
A buffet.
What do you take with you? Do you take your camera or do you take your high speed?
Oh, jeez.
Wow. What an interesting question.
Do you want to come back to that?
Well, am I seeing patients on this island?
Yeah, we'll say that like it's completely lined up, and like let's say this island has like
it's not really a deserted island, then, is it?
Well, I'm making it difficult.
A remote island. How about that?
I'm trying to get to this point,
Gotcha.
right? Like,
okay. I'll stop making fun of you now.
And we'll say that this island is like there's so many opportunities for photography on this island too. So you have unlimited patience to work on.
I'll tell you what. They're both necessary. If I'm actually treating patients, I can't really fix their teeth with the camera. However, in my practice, I see the camera as indispensable. Like, I couldn't imagine practicing without a camera. Like, I probably shoot like 50 to 100 photos every day at work.
Oh, wow.
So
right.
and be it lab communication, shade matching, um, you know, aesthetic workups, before and after photos for social media. Like, it's such an important tool, and it's really improved my level of dentistry, because when I examine everything that I do through photography, I can improve upon things, because I'm actually looking at this filling I did, or this crown prep that I did on a 50-inch screen, and I can just very quickly pick out the stuff I could have done better.
Yeah.
So over the years, like, I don't know if there's anything more than photography that has improved the quality of my dentistry. Um, if I were on an island and wasn't doing dentistry, I would definitely choose my camera over the
Awesome.
I have a question. So
Great way to dance around that answer.
yeah,
It's perfect.
It's a perfect answer. So I come from the entertainment industry. So I worked in film and TV for years and years. And in my journey, I did take a cinematography course. And I remember being just like, my mind just got blown on like all the ins and outs of cameras, and it just really, like, the depth of which you can go into. And this is back in I'm going to say like the mid to late 90s. The scope, like, and the breadth of knowledge that you have to have around a camera at that time, especially if you want to get into a cinematic position, like a director of photography or whatever, what have you. Having to know what you had to know was crazy, where you had to figure out how far away the object was. You had to do a light reading and figure out, like, and then the actor would move, and you have to make sure you measure where the actor is going to be at all those times. So first question is, do you use more than one camera? And second question is, like, how in depth do you get on that stuff? Do you have to do light readings? Do you have to figure out how far away the object is? Like, or does the camera do most of that work for you?
I think if you're just simply doing like day-to-day dentistry, like photographing and documenting your day-to-day dentistry, that sort of photography is very simple. Like, you just need a decent camera with a decent flash, and settings are almost the exact same every day, because you're always working in the same room. The lighting's always the same.
Right. You have a controlled environment. Yeah.
So it's so it's all like preset. Once you get into like, and it can be like that with portrait photography in the dental office too. Like, if you just wanted just your standard portrait for lab communication or for your before and afters, like, you can have it all very like pre-planned and already set up, so you don't really have to mess with too much. For me, I get into a little more of what you're talking about, because when I do photo shoots, my goal is to always make every single photo shoot look completely different. So I mess around with different lighting and move lights around and do light metering and stuff like that. So if you're getting into like more hardcore studio photography, then yes, you do want to make sure you really know how to operate studio lighting properly and whatnot. In terms of how many cameras I have too many cameras. But you really only need one.
What's your favorite?
I want to know how many cameras you have.
What's your favorite camera? What's your favorite lens?
Ooh, good question.
I find, like, in the office, my workhorses, I have a Canon 6D Mark II, which is a very inexpensive full frame camera. Works great for the office. I don't think you need anything fancier than that if you're just taking dental photography.
That's a great point.
And I pair that with a 100 millimeter f2.8L Canon lens.
Nice.
But I also have a few cameras. But I have another camera, a Canon EOS R. I just have that one because I use it for cross-polarized photography for shade matching.
Awesome.
Just so I don't have to switch filters and stuff, I can just grab. It's just faster to grab a different camera. And then personally, I like if I'm shooting portraits outdoors or landscape or whatever, for all my portrait or for all my personal photography, I use a Sony A7R 3 mirrorless camera.
Nice. I am a mirrorless fan. I love the Sony.
You're
camera.
like this. Sorry, you guys are talking the same language because I don't get into cameras. Yeah. It's funny because I was like I said, I was in film and TV for years, but like I don't get into the technicals of cameras. So
we've got 3 Sonys and just A6400s for the studio, but
you really bug out on this stuff.
I love it. It's like Gordon will attest. It's a tool. It's our tool. It's our tool to capture.
But I guess it's like quicksand, right? Once you start playing with cameras and lenses and seeing all the different results you can get, I can see that would be like I would pick that up and I would start getting obsessed with it in a hurry.
Yeah, it's fun. Yeah. It's a lot of fun.
Yeah,
I would also take 1,000 pictures a day.
I usually tell people like it's far more important to learn like the techniques of photography rather than have a fancy camera. Like I would much rather trust a professional photographer with like a phone camera than a beginner with a $5,000 SLR camera.
Totally.
So,
yes.
Yeah. So
I'd be the guy with the SLR. Like, I'm not sure how to use this thing, but it's fancy.
Yeah. So it's more so like it's the archer, not the arrow.
I love that. Yes.
Yeah.
I love that. Yeah, it's so true. It is so true. Yeah.
Can you talk a little bit about? Sorry, Mark, I jumped in on you.
Jump in.
You okay?
Yeah.
Aesthetic dentistry. So I know you have that right on your Insta, your IG. So, we've talked in the past about cosmetic versus aesthetic. So I know that you have aesthetic on your IG. Like, do you want to talk a little bit about like, if I'm a patient listening to you talk about aesthetic dentistry, what really does that mean?
Well, for me, the difference between aesthetic and cosmetic, basically, your main thing is to make something look nicer. But to me, aesthetic dentistry is making something look nicer, but also maximize the functionality of it. So, it's function and art together, and making something beautiful, but making something that's beautiful and long lasting and comfortable and function with your mouth properly, rather than just, throwing on veneers on everything that you see.
Right.
Oh yeah, we have to eat with these things too.
That's right. There is a functional component to this, right?
Yeah. And then, sure. I mean, goodness, when it comes to your TMJ, there's all sorts of issues stem to that, and has a lot to do with occlusion. And if that's not set up properly, all sorts of things.
And bonding.
Yeah. Yep. Cool. With our mutual friend Paresh and Sunny, you guys have an amazing course coming in September. Am I correct?
Yes.
Talk to us a little bit about that.
Excited. Yeah, pretty excited for that one. The 3 of us are very good friends, and they've been very successful doing their Elevate Dentistry posterior course. So they wanted to do an anterior course and invited me to join them. So the 3 of us are going to do a 3D course in Winnipeg, September 15th to 17th. And it'll be a lot of hands-on, over-the-shoulder live patient. We'll be planning to probably in the morning do a preparation in the morning, and then in the afternoon do an insert on a different patient. And yeah, super stoked about it. We sold out very quickly. Our wait list has enough for a second course. We actually haven't even decided a date on yet. So,
oh wow, awesome!
We should have, hopefully 2 sold out courses, and we'll see what happens. Hopefully, it's something that we can do regularly. Our big thing was we found that in Canada there wasn't any sort of courses like this available. And so we just wanted to have some, we wanted to have just a really good world-class level course north of the U.S. border. And especially with COVID, international travel is so difficult. So, we wanted something for Canadians mainly, but we do have attendees coming from the U.S. for it.
Yeah. And it'll be really refreshing to get back in, I'm assuming, back into a one-on-one setting or an in-person setting, getting your hands back on the tools and having that mentorship. Yeah. I know that, through COVID, everything's been remote, but I will say I've been lucky enough to be invited to 1 or 2 sessions as of late in person. And I'm telling you, the energy is electric. People just getting back into a room together, it is amazing.
What's that like, Tyler?
Yeah.
It was amazing. It just like so. If I were you, I'd be looking forward to that, which I'm sure you are. It's going to be great to be in an in-person setting again. Sorry, you may have already said this, so forgive me if I'm repeating. Where did you say it was located? The course?
Oh, it's in Winnipeg.
In Winnipeg.
We're actually going to be doing it at Paresh's office because he has a pretty large office, and then he has,
brand new, beautiful.
Yeah, he has
office,
this sort of like lecture area downstairs, so we're just gonna do it out of his practice.
And he's got all the tools. He's got all the toys. He's got printers. He's got all sorts of cool gadgets in the office.
Yeah, and we're just limiting it to like 12 people a class, just to have like a really good like attendee to instructor ratio.
Yeah, awesome.
It's at 4 to 1. So.
Yeah. When are you doing one in Vancouver?
We'll see. I'd love to. I used to practice in Vancouver, so.
Oh, really?
And I know a lot.
Where did you practice?
There, so yeah, I would love to do that in Vancouver.
Yeah, we'll set the venue up for you if you want to come to Vancouver.
Hey, yeah, we come do it in the studio.
We might need to bring a dental chair to the studio, but we'll figure it out.
Let us film it at least. Awesome. This has been amazing. Thank you so much for your time, Dr. Chee. Anything top of mind that you'd like to share? Anything interesting happening with the Calgary Flames? What's top of mind for you right now?
Top of mind. I don't know, Urge. I'm just really excited to get traveling again. I'm hoping this whole COVID thing is over. Alberta will be lifting all the mandates pretty soon here, so we'll see how it goes. Hopefully we don't get like a big resurgence and things go back to normal and everyone will be happy. And I'm really excited for this year for all the courses we'll be doing, especially the in-person ones. As you say, it'll be really nice to actually get together with friends and meet new dentists and sort of socialize in the same room. So
yeah, that's
great.
Just to get to see each other again. Yeah,
so Tyler and I will come. We'll come to the Stampede then this summer. We'll hang out.
I think I'm actually in Calgary in July.
Are you?
I think I might be there.
Oh, there you go.
For an event in July. So,
okay.
I'll definitely have to say hello when I'm in town.
There you go.
Yeah,
it's on. I'm coming. Party time.
Dr. Chee, we know how busy you are, so thank you so much for being with us today. Keep doing what you're doing.
Thanks so much.
It's a real inspiration to watch what you're doing out there, and we always point dentists in your direction. We're like, you really got to watch what this guy's doing. It's really cool. It's innovative. It's broadening. Dentistry needs this.
Yes,
in my opinion.
So, yeah.
So please, you and Paresh and Sunny. Is it Sunny? I haven't met Sunny.
Yeah.
Keep forging ahead. You're really changing the landscape of this industry. So thank you.
Thank you very much. I really enjoyed being on. So thanks for having me.
Well, next we'll talk about doing a 3-parter series next.
That's right.
Yeah.
Sounds good.
Awesome. All right. Have a good
Enjoy
day.
your week.
Thanks. You too.
See you later.
Thank you.
Bye.